For the most part, nursing care plans are moving away from the idea of using nursing diagnoses, but there's still nursing issues. So diagnosis and analyze. What is the priority intervention for the client with metabolic acidosis and septic shock? Well, they need to go to the hospital. They're pretty sick. What else is priority? Don't you wish you had some choices to pick from?
Yeah.
Blood pressure.
Circulation.
So what about circulation?
IV access.
An IV access so that you can address their blood pressure. So your priority intervention, because you know that if they've got metabolic acidosis and they're in septic shock, that we're looking at some cardiovascular issues, right? Poor cardiac output. So the very next thing I probably want to do is to get an IV started so that I've got a way to get IV fluids in. Now, if the stem changes and you've already got signs of hypoxia, then you might treat the oxygenation first because that would be a higher priority than the circulation. What finding in the client's environment presents the highest risk to the client's safety? So what kinds of things do you see? So you could take this home environment or the patient environment. You've all done community at some point, right? Or are in it. So what do you worry about when you go into someone's personal environment? What kind of risks are you assessing?
Fall risk.
What does that mean?
Like rugs on the floor that they could possibly trip over.
Clutter.
Rugs, lighting, clutter, pets?
Mm-hmm.
Yeah.
A lot of people trip over their cats.
A lot of dogs will knock your legs out from underneath you. So, all right, so let's say we've got those hazards. All right, so we're talking about a cat, an area rug, poor lighting, and what was the other one?
Clutter.
Clutter. So, out of the environment, which one of those would be the highest concern?
Butter?
The lighting.
Why the lighting?
Because they already probably, if they're elderly, have poor vision anyway.
So they might already have really poor vision, and lighting helps a tremendous amount, whether it's glaucoma or cataracts or whatever. Increasing the lighting helps. But all of the hazards can be avoided if
You can see them.
you can see them. So we'll talk a little bit about kind of umbrella answers, and that would be one of those. Like it kind of addresses everything. Now, do we want to move the rugs out? Yes. But how many areas do people have throw rugs? Like the kitchen and bathroom. All right, so great, we've addressed, 1/10 of the house. The cat, okay, I mean, a cat's gonna get under your feet twice a day and the rest of the time it's gonna stay curled up in a corner somewhere, right? Before administering, now you can insert whatever drug, digoxin, metoprolol, vancomycin, potassium, furosemide, any drug you want. The nurse's priority is to check which lab or assessment. And we've talked about some of these. Let's see, we didn't talk about metoprolol. So you're given a blood pressure medicine. What is your priority assessment? Blood pressure. Is there any lab in particular that you're going to be concerned about? Not necessarily, right? Blood pressure and pulse, and we're good. If you're giving furosemide, which things are you looking for?
You're going to check blood pressure.
I want blood pressure for that one too. What else?
Potassium alone.
I want to know what their potassium was.
Make sure it's working, I guess, and put
You want to check their kidneys.
I want to know what their urine output has been, and I want to know what their kidney function looks like. Because you can diurese somebody right into acute renal failure. So if we made those all specific examples, all right, so with our acute kidney failure, let's say that the answer choice is the patient has a BUN of 25. And let's say their urine output for the past 4 hours was 50 milliliters. And
Say 50 or 15.
50. What else did we say? Potassium. So let's say their potassium was 3.7. Out of those, which one are you most concerned about?
The BUN. The urine output.
The output was really low. The BUN was high, but it wasn't that out of range. The potassium was low, but it wasn't really out of range yet. So out of those values, the one that you would actually be most concerned about would be the fact that it doesn't seem to be working. So whether that means that they're starting to have kidney failure and that's why they're not putting out fluid, or whether that means that that we need to give them a different drug or a different dose. Whichever way it goes, that furosemide's not working well, or else they would have how much in that 4-hour period? How much urine output do you need in 4 hours?
120.
At least 120. And if it's a big guy, more like 200.